Good morning, everyone. Thank you so much for joining us for our webinar, All of Us in the Alamo City Matter, Where You Live Impacts Your Health. Just a quick housekeeping notice before we get started today. This webinar is being recorded, and by being here, you are giving your consent to be photographed, filmed, and recorded as well. All right, and so we will dive right in this morning. We would like to welcome you to our panel discussion and Q&A session that will talk about how the All of Us research program is making an impact here in the Alamo City. Today, we will take time to explore the state of social determinants of health in San Antonio and how we can leverage the All of Us research program to promote health equity and health research. We hope for this to be an interactive discussion for San Antonio leaders, health agencies, healthcare professionals, social nonprofit and community group leaders, schools and universities, other groups and orgs, and individuals who want to learn more about the social determinants of health facing our local communities here in San Antonio and in surrounding areas. We hope you're inspired by our conversation today and are moved to join us in this effort by either personally joining the program and or by partnering with us to share this program with the communities in which you serve. During the presentation today, I do invite you to interact with us by putting any comments that you have in our interact button. Feel free to post those throughout the webinar, and we will have a Q&A session towards the end. And so I just, first of all, like to introduce myself. My name is Allison Ray. I am the manager for clinical research at South Texas Blood and Tissue. I'll be serving as the moderator in today's discussion. Next up, I'd like to introduce our three panelists. So first up, we have Adrian Mendoza, who is the Senior VP of BioBridge Global and Chief Operating Officer of South Texas Blood and Tissue. Adrian has been part of the BioBridge Global enterprise since 2016. With over 25 years of experience in quality systems, regulatory affairs, Lean Six Sigma, and strategic planning, she possesses expertise in blood and blood components, cell-based advanced therapies, and human tissue products. She is a member of the Young American Leaders Program at Harvard Business School's U.S. Competitiveness Project. Adrian enjoys team building, art, music, and loves spending her free times outdoors, camping, and horseback riding. Next up, we'll move to Dr. Emily Ramirez. She is the chair and professor of population health sciences and the director of the Institute for Health Promotion Research at UT Health San Antonio. Dr. Ramirez is an internationally recognized cancer and disease health disparities researcher and is also an associate director of community outreach and engagement at the Mays Center at UT Health San Antonio. Over the past 30 years, Dr. Ramirez has led over 100 studies and communications projects that have reduced Latino health disparities. She is the leader of the Salute America National Program that fuels system and policy changes to build a culture of health equity for Latinos and all people. And rounding out our panel today is Crystal Requejo. She is the Chief Operating Officer of Programs and Development at the Mexican American Unity Council. Crystal was born and raised in the west side of San Antonio. Her desire to serve her community has led her to continue her passion at the Mexican American Unity Council. Crystal has been with the Mexican American Unity Council for over 16 years, and she currently oversees all programs and operations at MOC and at its 3 affordable housing properties. She holds multiple certifications that help reduce social determinants of health in the community. In November 2018, Crystal completed the National Association of Latinos Community Asset Builders Pete Gallegos Fellowship and received her nonprofit management certification from the University of Texas at San Antonio. Crystal is married and is the proud mother of twin girls, Emily and Elena. So I'd like to go ahead and pass it over to the panelists themselves now to introduce themselves as well as their organizations and missions. So first off, I'll pass it to Adrian Mendoza.
Hello and welcome everyone. I work at a great organization here located in San Antonio, Texas. It's BioBridge Global, and our mission is to save and enhance lives through the healing power of human cells and tissues. We serve about 100 hospitals across 48 counties and are very committed to the population's health in our area, which is why we are participating in All of Us and are very excited about what this research program will offer. So with that, I'll turn it over to Dr. Ramirez to introduce herself to and where she works.
Thank you very much, Adrian and Allison, for the wonderful introduction. My name is Emily Ramirez, and I'm professor and chair of population sciences here at UT Health San Antonio. And it's really an honor to be here with all of you. Is to really reduce disparities in general, chronic and cancer health disparities throughout South Texas and the nation. And we have built an amazing program called Salud America that has a digital network of over 500,000 community leaders, school individuals, parents, and healthcare professionals who help us bring the latest information to our Latino communities about health. And we provide them with tools and information that they need to truly make a difference in their community, and also how they can become advocates for change, particularly at the local and state level. So thank you so much for the opportunity to be here with you.
Hi, everyone. I am
Crystal. Yes.
Thank you. I'm Crystal Requejo. I am the COO for Mexican American Unity Council, located in the west side of San Antonio. We have been here for over 56 years in the community, serving the west side and the city of San Antonio. Our mission is to empower communities through housing, education, and economic opportunity. MOC has a long long history of being a community partner and really work bringing in programs and innovative programs into the community and helping fill gaps when there's needs within the community. And we felt that all of us, which is such a great program to bring and try to help other people in the community register for this program. We build stronger communities by providing a holistic wraparound service to the entire family. So we're excited to be here. Thank you, Allison.
Awesome. Thank you all for introducing yourselves. So first up on the agenda today is to just go over a brief overview of the All of Us research program and what participation looks like. So for that, Adrian will be presenting that. So I'll pass it to you.
Great. Well, this program was launched in May of 2018 with the goal of establishing really a historic, most impressive research database, the largest and most diverse health database that has ever been accessible to researchers. It's helping to support a better understanding of health as it relates to a diverse population. And why is this so important? It's really because there are aspects of historically available information which make for incomplete data resources to study disease across a broad range of society. And that includes real-world evidence of how social determinants of health impact health outcomes. Participants contribute by sharing health information through online surveys and by donating samples of blood, urine, or saliva. Next slide, Allison. I'll go over some of the approaches that this takes to answer questions like what are shown on the slide. All of Us is focused on enabling precision medicine research through a disease-agnostic approach, which means that rather than focusing on a specific disease area, the research instead emphasizes a broader approach to study diversity across a range of demographics. And we have a very diverse society and culture here in San Antonio, which makes for a great opportunity for participants in the All of Us program to contribute to the research study. The approach aims to create a comprehensive database that can be utilized for a wide range of research purposes. And you'll hear more about that as we go on today, about how the data is used, how it's protected, and how it's made available to researchers in order to study the different populations and the impact that social determinants of health have on health. Next slide. Some of the unique features about this program and the innovative aspects of All of Us is that it boasts a diverse participant base. It is really trying to create a participant base of over 1 million people, representing a broad range of society and inclusive of every walk of life and anyone who can really demonstrate any social determinant of health that might apply. We are collecting data longitudinally over time, meaning that someone who participates actually contributes over their lifetime. And we want to know over time how their social determinants affect their health and how they're doing. So that's providing researchers with valuable insights, not only today, but into the future, into health trends and patterns. The participants are actively engaged as partners in the program's development. They receive feedback about their data, including the physical measurements and DNA results potentially, if they have their DNA results received. And data is collected, that is collected is broadly made available to researchers while also ensuring the strict measures are in place to protect the participants' privacy. So it really is about creating a comprehensive database where over time, the people who are participating in this continue to participate and continue to develop that database of research, and really give us insights that we've never had before in order to empower the future of medicine and make sure that everyone has access and equitable access to healthcare. And slide 7, I guess, Allison. What can participants expect if they're asked to contribute to the advancement of future healthcare by sharing their health information? There's not monetary costs at all for any participant. And though there is a time investment required, there is time expected of the participants to contribute to the information that makes the database so diverse and inclusive. They're expected to provide various types of information, including basic details about themselves and their health, their family history, and their lifestyle habits. And by participating, individuals have the opportunity to learn about their genetic predispositions to certain diseases and how their bodies might respond to medications, as well as gaining insights to their unique traits and ancestry. And I think one of the most impressive things about this research program really is that it's a building database. So over time, the power of the research and the database itself will actually give way to insights that we currently don't have. And so there might be insights we know today that will be shaped and made improved over time, and things that we don't know today that this research will actually empower discovery of. So to join, individuals can visit the All of Us Research Program website and go through an informed consent process, ensuring that they understand all the risks and benefits of participation. And it's really already seen significant engagement. There's over 765,000 participants and over 525,000 plus completions to date. It's really building, and every day we're enrolling more and more participants in this program. South Texas Blood and Tissue, where I am the Chief Operating Officer within BioBridge Global, has been actively enrolling participants since June of 2022, and we've been able to collect 400 biosamples at our center, and of course with the support of and empowerment of those who are with me on this call today and others in our community. We're making an impact in helping this research advance. So with that, I'll think I'll turn it back over to you, Allison, to kind of go into our next topics. Oh, Allison, maybe mute.
Oh, there we go. Okay, I'm so sorry. Thank you so much, Adrienne, for that quick overview. And so now I would just like to pass it to Dr. Ramirez and to Crystal to go over why their organizations decided to get involved with the All of Us Research Program and what kind of drove that decision. Oh, you're muted too, Dr. Ramirez.
Great. I'm so sorry. We're excited to be here today with all of you and to be part of the All of Us program, because our Institute for Health Promotion Research, along with Salud America, has really devoted itself to informing our communities about what actions they can take to improve their health. As you well know, many of our Latino population now is the largest minority population in the United States, but they remain underrepresented in clinical trials and in different types of research studies. And as Adrienne just explained, sometimes some of the medication that's currently available doesn't really work for our communities. A good example is, for example, our children with pediatric leukemia. The current drugs that are available for them are not as effective as they could be. So getting our communities to participate in programs like All of Us is extremely important. And we feel that the combination of both outreach and education through social media, as well as on the ground efforts through our community health workers and our patient navigators, is the best way to inform our communities about what they can do to be available to answer any questions that they may have. And, we really hope that working together with the All of Us program, that we can truly make a difference. And, as Adrienne said, make this program really representative of all our population groups in the United States, so that we can make healthcare more equitable for everyone. So thank you.
Thank you, Dr. Ramirez. So yes, for MOC, when the opportunity came to us and we were able to be part of one of the organizations to join, I think what really caught our attention was being able to really include our community. Communities like the west side of San Antonio, which are predominantly Latino or low-income communities, tend to not really be at the table when research comes to mind. It's not something that we see very often. And so we wanted to be able to be a partner to really educate our community on the importance of being part of a research program like all of us. When we were able to learn more about the program, what really caught my attention was precise medicine. And we know that if we're able to create precise medicine for future generations, that would be great. We know that Latinos tend to have a high rate of diabetes or cholesterol or high blood pressure, and not all medicine tends to work alike. We know a lot of our Latino communities tend to be on dialysis. And so how do we prevent our communities getting to that point? And I think that by being included in research programs like all of us, we're really able to create that precise medication for our communities. Even when we talked about the pandemic, not all vaccines were the same, right? And so people had reactions to things that others didn't. And so I think when we talk about communities of color, we're able to really have them be included and at the table. We're able to really have a bigger grasp of knowledge. And I think we can create that precise medicine for not just my kids, but for future generations down the line.
Thank you so much, Crystal and Dr. Ramirez. It's always great to hear why we're getting involved across San Antonio. And we're so excited to have both the Mexican American Unity Council and UT Health on board with the All of Us Research Program and sharing this program in their communities. So our next kind of topic of discussion today is going to go over the social determinants of health in San Antonio and how we can leverage the All of Us Research Program to promote health equity and health research. And so I just want to pass this over to the panelists as well. We're going to mix it up and we're going to start with Crystal for this one.
Thank you, Allison. Yeah, so I think something that always stuck out to me was where you live matters. And I know that's kind of our title is where you live impacts your health. But truly, when we talk about where you live, even your zip code can determine a lot about your health. We know that here in San Antonio, if you live in 78207, which is like the heart of the west side of San Antonio, your life expectancy is 62. Versus if you live on the north side of town, which is like 78254, your life expectancy is 92. Which I think that speaks volumes to why it's so critical to really talk about the social determinants of health, like access to food, healthy food, access to doctors, a great education, have a stable house to live in. All of these are factors that really determine our life expectancy. And I think that we don't sometimes correlate that or really have those conversations of how do we bridge those things together. And I think that in order for us to really have a wider impact with all of us, having people from these communities can be such a great asset to figure out why are they not living to 92? Like what do they need to be able to live their full life expectancy like other communities or other zip codes. And so I think that just to be able to really have this conversation is so critical because I think that for me, if we can say where you live matters, it shouldn't matter. It should be everyone should have the same opportunities and equal opportunities to have access to healthy foods and not live in food deserts. And so we know in the community that I serve, food deserts are something that exist. And so they don't have access to quality foods. And so I think that those are things that we should definitely bring to light. We know that unfortunately, a lot of times there's been historical discriminatory processes and practices that have been in place for generations, such as redlining and things of that nature. And so I think that really focusing on how can we create an equal opportunity for all of our communities is essential. And I can hand it off to Dr. Ramirez to continue the conversation. I think you're muted, Dr. Ramirez.
Thank you. A great description, Crystal. You've highlighted many of the most important facts. Everybody says, tell me your zip code and I can tell you, a little bit about your health. And so it is important to better understand there's both medical needs and there's both non-medical needs that impact our health. And some of the non-medical needs that, Crystal has just described is that our community, tends to have lower income wages. They tend to have lower education. They have poor access to health care. And as you were just said, due to redlining, having access just to transportation to go and see the doctor. These kinds of things are are really impact their health and the access of just having sidewalks to walk in your community to where you feel safe, or having access to real grocery stores where you can get fresh fruits and vegetables. All of these things we have found are kind of disproportionately represented among many of our Latino communities. And so we are really working hard within the healthcare system to better understand that. So through a grant that we received from the American Cancer Society, we are working with our clinicians to do a better assessment of what are some of those social determinants of needs where our patients need help, so that we can help address those needs and they can concentrate more on improving their health. So these are things that we really have to work on. And the reason it's a concern is that we know, for example, childhood obesity in our children is almost 30% higher compared to the rest of the United States. These are Latino children that are going to be living longer with chronic diseases if we don't do something about it earlier on. And as Crystal mentioned, diabetes, the shortening of lifespan and the consequences that has on their health also is a major factor, and people don't want to have to go into dialysis and live on dialysis. So we need to work together as a community to truly trying to make a difference in that. And so it's truly a puzzle, and the All of Us program is one of those pieces, because if we can better understand what are the unique needs of our community from both acculturation, I think, Adrienne, you had mentioned that, and just the Latino community, we represent a wide range of cultures within the label Latino or Hispanic, anywhere from European to Native American to Central African, and that DNA, even though people say it's only 10% of the DNA that truly impacts health, we need to know about, because there are these differences. And so we need to encourage and educate our communities with why this study, which really is designed to want to help you in the future, is important. So thank you very much. So Allison?
Thanks so much. And Adrienne, do you have anything you'd like to add?
I just think about all of the different social contexts and community contexts people live in our community, and how broadly it can impact their health. And you just heard those examples of how a zip code can really impact someone's longevity and their access to care. And when we think about the aims of this program and really understanding those, giving access to knowledge that will empower the things that we'll be putting in place in the future to mitigate the impact, or at least focus in on how we can create more economic stability, more context of equity within the communities that people live in our area and all over the country. I think it's really important. This is really the most important research study that's being conducted at the scale anywhere.
Yeah, and I think you said it, Adrienne, the scale of the research study is huge. With 1 million participants being asked to join, we're able to get a better picture truly of different communities. And without that volume, sometimes I don't think you're not able to see those differences. So
yeah, I'd like to add, just Allison, too, that, most of the studies have been done like in Asia and so forth, and not truly representative of our communities here in the United States. And so that's why this is, as you both have said, is one of the leading studies to help us, get better information that in the future researchers can use to help us get better understanding of why we see more illnesses in one group versus another.
Definitely. And its ability to tie the different parts, you're getting not only physical measurements and blood samples, but electronic health records, and being able to tie all of that information, as well as, where people live, and put all of that information in one place. That's huge. Just a lot of information for each person. But yeah. Anything else that anyone would like to add on that topic? No. Okay, awesome. Well, we want to go ahead and open it up for some questions from the audience. So I did have one question come in, and I think I'll probably pass this to Dr. Ramirez. This question is, how can researchers use this data set?
Yes, thank you so much. In terms of the data sets, as I mentioned earlier, already we have some studies going on. For example, some of the researchers are beginning to look at sex differences with regards to lung cancer. Women in general smoke less, but we don't understand why they're getting lung cancer as well. And then in our Latino population, they also tend to smoke less. They tend to be more social smokers, but we see vaping going up. What kind of differences are we going to find for that? So these are just some unique studies going on. Also, as we've talked about, diabetes is just such a huge illness in our population that there are studies right now looking at type 2 diabetes among Hispanics in the United States and looking at the differences among the different population groups. Cubans and Puerto Ricans, Mexican Americans are not all the same. And so they're beginning to look at some of these sub-differences.
Yeah, and I think we really saw on that slide from Adrian that, this data set can really help to answer a massive number of questions. And so if you are a researcher out there and you're interested in learning more about what information is available, you can visit researchallofus.org. And that's going to give you kind of the steps to becoming a researcher and actually getting to use this data set. And so we had another question come in. Awesome. Okay, so our next question that came in is, what are the risks to my privacy if I decide to participate? So will researchers know who I am? And I think I'll probably pass this question to Adrian.
Sure. Well, your privacy is absolutely paramount. There are extensive measures taken to safeguard the information, and it's all collected and stored securely on protected computers with restricted access. In fact, the database that links a name to an anonymized number really is only accessible to very few people, and that is strictly secured. Personal identifiers are replaced with codes, just kind of like what I mentioned. That master list that links the codes to the names is not available to just any researcher that's going into the database. Researchers actually have to pledge not to attempt to identify participants as well. And any participant who's part of this would be notified if there's any data breach at all. So it's very secure. There's even a certificate of confidentiality from the US government that would actually resist legal demands for identifying information too. So they've taken a lot of measures to make sure that any participant's data that's unique to them and can be identified back to them is secure. And anyone who accesses the database has to pledge to never try to identify that participant. And anyone who is participating also has the right to withdraw at any time. You have the option to request a removal, and the retention of the data and samples will also be removed. So any future research, if you choose to withdraw at that time, would be suspended around your information.
Thanks so much, Adrian. And we know that, there's always hesitancies about sharing your information, but I feel that the All of Us research program really does take all steps to try to protect that privacy in every way that they can. So we have another question that's come in through the chat, and it asks, how have your communities welcomed the All of Us research program so far? Have you faced challenges engaging your community? So I think I will pass that over to Crystal first, and then maybe we'll also let Dr. Ramirez share since your groups are the newest to join.
So we started working with our communities in the beginning of, I guess, mid-November is when we really started working with our communities and to really share and do outreach. So our first phase at MOC has been to really do outreach and really educate the community on what All of Us is. We really hadn't, we know that our community hadn't heard of it before. So we knew that we needed to first give that education, really speak to what the program is, because we knew there was going to be some hesitancy on like privacy. And then another huge challenge our community faces is the technology. So having the technology to do the surveys, to be able to enroll. So part of our commitment to be part of the program is to assist the blood bank to be able to help with the enrollment. So we can help walk the clients to enroll, to help if there's any language barriers, we can assist. So really knowing our community, knowing what the needs are, we're really trying to step in and kind of fill those gaps to be able to bring the full awareness of of the program and then able to help them enroll. We know there's going to be some hesitancy, and we've seen the enrollments haven't been high yet, but that's why we started off with this first phase of really showing the community what it is, letting our community partners know. I think this is why it was so important for us to have this conversation today, is so that people across the city know what we're doing and really leverage the program through different partnerships. Because I think that the awareness really helps by the legitimacy of the program. So if you hear from multiple people, you're like, oh, I've heard of all of us. And it kind of helps the community also understand what it is and help with enrollment. So there definitely has been challenges, but I feel like the more we talk about it, the more education that comes through the program and through trusted partners and nonprofits and organizations, we're able to really start building up and seeing more people join the program. And I can hand it off to Dr. Ramirez to continue the conversation.
Yeah, thank you so much, Crystal. You've highlighted a number of important points. One, that we're a trusted partner, that our communities know us and trust us, and that we can get them involved. But the education wasn't there. Some folks again are concerned with, how are you going to use my information? Will it be turned in? Am I legal? Not legal? All of these things come into play. So I think our first steps were really on educating. Why? What is All of Us? Why is it important to get good representation in the All of Us program? And then secondly, using our community outreach approaches to help to take them through the steps. We recently had a conference called Advancing the Science of Cancer in Latinos. And even in that conference, with a number of individuals being Hispanic, they weren't quite sure, and so it was really interesting to, they understood the importance of the study, but they themselves hadn't participated yet. So again, that one-on-one interaction, the trusting how the data is going to be utilized, the time constraint is a commitment, but once that information is in there, it'll be in there for a long time and can be used in so many different ways. And so the dual approach of social media outreach and education is truly important.
If I can just add really quickly, Allison, I think for us to also fully understand the program, we actually had our staff and team learn about it. And Allison came out with her team and gave a presentation just internally for us to really understand the process, and also ask our team and our staff to be part of this program. Because I think if me personally going through, doing the surveys, being part of it, I think helps us really be able to share and give more information to the community as being someone who's also enrolled in the program. So I think it's critical. So we started with our staff first, and then we started with community after that.
Yeah, we have to be involved, right? We have to be, part of it so that we can explain it as thoroughly as possible, and also show that we've taken the initiative to be a part of it.
Definitely. Yeah, and we're happy to come out and talk to any groups really across San Antonio that may want to get involved. We love to send our staff out and just continue to educate. We understand that, it's each person's individual decision whether or not to participate, but we just want people to be fully informed on what the program is, understand its benefits, and then they get to decide, if they'd like that to participate or not. And like Dr. Ramirez mentioned, it is often a personal conversation that you have with each person, because that's how they know, and they get to ask their questions. All right. If there's no more to add on that, I'll move on to our next question. Can you elaborate on what benefits there are for participating in the program? So for participants themselves, what are the benefits? And I'll go ahead and pass this one, I believe, to Adrian as well. And if anyone else wants to add in, y'all can too.
Sure, I'd love to. Well, the benefits are that a participant actively shapes the program and actually receives personal health information back. So it's not just giving to research, but also receiving information and insights back about their personal health and maybe challenges that they might experience in accessing great health care, and making sure that they're empowered with that information. Access to increasingly comprehensive health records over time. So just like I mentioned earlier, participation and knowledge in this program will actually help provide increasingly more comprehensive details back to participants. So as more information and insights become known through the research, that can be shared back to participants, and they'll actually receive insights that are specifically tailored to their unique conditions and results. They'll receive physical measurements results, including their height, weight, blood pressure, of course, those kind of physical things. And so that's helpful to know because it might give them some indicators of their health status at the moment that they should check into. And they can also discover genetic risk factors. You can enroll to receive or not receive DNA results, so that's optional, but they can discover genetic risk factors for disease, aiding in prevention and treatment for them. And they can understand better how their body responds to medications, and that way they can improve the efficacy and the function of those medications they're taking to treat their conditions. And they can also learn about unique traits and ancestry through the DNA information as well. So it's always really interesting for people to discover some of their origin story that they might not know about. And this is a unique opportunity for participants to receive access to that freely. So those are some of the benefits. And of course, I think the biggest benefit is being able to shape the future of medicine, empower precision medicine for the future. So it may not be impacts that someone can make today, but it's the future. It's the next generation. It's stopping the cycle of these inequities from happening in the future. And that is the greatest benefit of all, I think.
Oh, and Dr. Mears, you're on mute.
Adrian, I think it's so important for our community to also share their history of their health illnesses. Oftentimes, many of our patients don't know what, that a relative or someone had cancer or so forth, and that, just beginning to think about this and putting it in the questionnaires, really gets them to talk to other family members about it, or to help them, once they get the information back, maybe have a more deeper conversation with their healthcare provider if they're questioning something. So I think it's going to be a very nice two-way conversation piece.
And just wanted to add, I think something that has caught interest in the conversations with the community has been being able to receive that genetic information, receiving just information about themselves, I think has been something that's piqued their interest. I know even just within conversations we've had within our team and all of us has been, wow, I get my genetic information kind of like 23andMe. I mean, so those are the things that sometimes people are excited to know more about and to get more information about what does it mean to them, what does their history look like, because many times it could be expensive to get that information, or it's not attainable for our community. So that's something they would be able to receive. And a lot of our community has had some interest in knowing they can receive that information.
Yeah, it's a huge benefit to participants for joining the program, and the program calls it return of value to participants. So we have found that a lot of people are interested in knowing that information. I will add the caveat that those results do take a little bit of time. So once you join the program, please do have patience with that portion. So we have had a few more questions come in. If a community member is ready to join the program, do they have to travel somewhere to join? And I will pass that to Adrian, or you can pass it back to me if you'd like as well.
Yeah, I might add you at the end, but I can tell you what I know. So just maybe I'll start with the enrollment process itself, because that does include at the conclusion or towards the end travel. But they'll scan a QR code, and that QR code will make available to all those who are on here, and also so that you can share it, because that's instrumental in helping us spread awareness about this program. But the participants will scan a QR code. They'll create an account. It's very simple. There's also a QR code for English or Spanish, and they can give consent there. There is an optional consent then to share electronic health records and to receive DNA results. Just like I mentioned, there's some additional enrollments people can fully participate up to the level that they're comfortable with. And then they'll complete a series of health surveys. And at the conclusion of those health surveys, they'll schedule a 30-minute appointment with us at South Texas Blood and Tissue. We have a facility here right in the heart of San Antonio that's really easily accessible to take those measurements and collect samples. And our team here is really friendly. It's very easy to schedule that time. It doesn't take long at all. And participants are reimbursed for time and travel for participating as well. Allison, do you want to add anything to that I might have missed?
Yeah, so the reimbursement after a blood sample donation is $25 through an Amazon gift card. And right now we are performing biosample collections only at our our donor pavilion. So that's at 6211 IH 10 West. However, we are looking into the ability to go out and do what we are going to call mobile collections. So come meet the community where they are. There are some logistics that our team is working through right now, but it's something that we are aiming to have completed and ready in the next couple months. So we want to be able to come to the community and meet them where they are. We do understand that sometimes transportation is an issue, and we want to remove any barriers that we can for that.
Yeah, so if anybody here listening, is representing an organization, please reach out to us. We'll make sure that we can go and provide the education and coordinate with the blood bank to make sure that we could also do the blood if the participant so decides.
And I know we're working on, that's kind of our next steps with working with Allison and your team, is to be able to bring you to the community, such as the mock center or locations that are in our community, to do it on site. But I know that when we were doing some of our training, if you can speak a little bit more on, they can do the mail-in samples. Mm-hmm.
Yes, definitely. And this kind of feeds into another question that we've had come through the chat. So that's great, Crystal. So once you have completed all of your online enrollment, at the very end, it's going to tell you if you're eligible, that you're eligible for a biosample collection. And it's going to give you all the options that are available in your area. So if you're doing this in San Antonio, you're going to see South Texas Blood and Tissue as an option to come give your biosamples. And that would be a blood donation, blood and urine. But you will also see a saliva option. So you can get a saliva kit actually mailed to your house. And you give that saliva sample and you mail it back in. They are able to get some DNA results from that saliva sample. We have heard that, blood is preferred if available, but saliva is another way to give and to participate, and you can do that right from your home. And if there are any other, so say you're not in San Antonio, you're in some other state, whatever options are available where you are located, that's going to show up on the All of Us research program, and then you can choose the option that best fits you. Okay, and we've had a few more questions come in. So how can doctors and other healthcare workers share with patients about joining the All of Us research program? And I think maybe Dr. Ramirez, I'll pass this one to you.
Oh, thank you. I think it's really important for doctors and physicians to know that this data is available, and they can also help us promote the program, because again, in terms of a trusted source of information and the confidence that their patient has with them, they're the primary source to help us encourage people to participate. And it's also can maybe provide them with enhanced information on their patient's health that they had not thought about, that they're looking a little closer at their ancestry and so forth, that might be of importance, or that something that might be impacting the condition that they have. So we do work closely with our clinicians and letting them know about the program.
And once again, I think this is a great opportunity. If you are a doctor or other healthcare worker and you're interested in sharing this information with your communities, there are lots of different flyers and different materials, even videos available that we could put up just to increase the knowledge and let folks know you're interested in promoting this program and promoting social determinants of health.
And just to add, Allison, I know you can reach out to any of our teams, and we're happy to send someone to come and give more information, drop off handouts, flyers. At the end, we'll have a kind of our emails up. Feel free to contact us directly. And if you feel like UT Health is closer to you, Mock, if you're looking at depending on your location, we're able to send out our teams to do more, give you more information, and even have a conversation with community in a class type setting, if that's something you're interested in.
Thank you so much, Crystal. And I did have one question come through that I'm going to have to follow up with after the webinar. Has there been any research on veterans and the social determinant of health with an emphasis on food securities in San Antonio? So I just want to acknowledge that we did receive that question, and we'll follow up with you after the webinar. And I don't see any other questions in the chat. Please feel free to continue sending them in if you do have any. And I'll open up to the panelists if y'all have anything else that you feel like we missed out on today that you wanna hit on.
I think it's just I think today's conversation, what our focus was trying just to bring awareness to community partners. So we did a more community partner level versus individual community. I think our next conversation we want to have might be a little bit more geared towards community. But if you can help us spread the word, if you can help us share the information, if you want more information and we can come out and speak to your team, to your staff, we're here. We're working together to really push this program throughout the next couple of years, hopefully years. But we're definitely here to be able to be a resource to you. And we invited each of you today to be able to really join us in being part of this movement to really help us join, the group of 1 million people that are part of this research. I think for our communities, creating that precise medicine, especially for Latinos, is so critical. So if we're able to really engage these communities, I think we're going to be very successful in the next kind of generation that's going to be giving this precise medicine.
Yeah, and I also like to welcome, if any of you are researchers, that this is something that you can use. Already we have about over 9,000 researchers who are utilizing the data that's been collected from the All of Us program. If you have a pilot study, a key question that you want to ask to kind of compare among different groups, this is a wonderful data source. You do have to go through a screening process, answer some questions, but once you have access to the data, it's very informative.
And lastly, I'll just add that I think we really have an opportunity to contribute San Antonio's diversity to the improvement of this research database, and enrolling more participants and getting more education out there about this program is so instrumental. So I echo Dr. Ramiro's and Christelle's request that anyone who's listening today take an active role with us to promote the importance of participating in this survey and raising awareness by sharing this on social media, any platforms they have, even just having the conversation with people that they know, and making sure that those individuals can also spread the word. It's when people are asked to participate by someone that they know that they're most likely to respond. So we really want the message to be amplified. And those of you who are listening today, I really thank you for being here and want to empower you to be our help to make sure that this research really is as fruitful as possibly can be.
And for example, going back to the question on veterans, we would love more veterans to participate in the program. So if there's a way that we can reach out to you, not necessarily answering your question on food insecurity, but getting them to participate in research, we'd gladly work with you as well.
That was so well said by all of our panelists. Thank you guys for all of your insight and your time today. We greatly appreciate it. And I did go ahead and put up a slide with some information on it while we were just kind of giving some closing type remarks. So I know all of the panelists did say, reach out to us. Well, how do you do that? Well, here are all of the panelists' emails, and feel free to reach out directly to one or several of them. And we would love for your organizations or you as an individual to get more involved with the program and with us. I also included a little bit of information on the All of Us Support Center. So anytime you have just general All of Us questions, there is a phone line and an email that you can call. And South Texas Blood and Tissue, I included right in the middle there. You'll see our email and our phone number. So this is our research line and our research email address. And so feel free to reach out to us there as well. And then I know Dr. Ramirez hit on becoming a researcher. So you're interested in becoming a researcher. How do you do that? Well, here's the QR code right here in the middle, bottom of the screen. Use that QR code or visit researchallofus.org. There are different levels or tiers of research that you can do. So just if you visit researchallofus.org, you can see basic aggregate data. So not any individual level data, but you can kind of look around and see what information is there, and it's at an aggregate level, and you don't need a special permission to be able to do that. There are further tiers as there are more information. Like Dr. Romero said, there's an application type process, and you can do that at an organization wide level. So go there to learn more if you are a researcher wanting to use all of this great data. And finally, I kind of worked backwards on this slide, but there is a Join Now QR codes on the left-hand side. So if you are interested in becoming a participant in this program, scan that QR code. The top is an English one. The bottom is Spanish. And then there also are some URLs, joinallofus.org/South Texas Blood. So visit those sites, fill out those consents, those surveys, and once you get to your biosample collection, we can schedule you for an appointment to come into our South Texas Blood and Tissue Center location, and just send us an email or a phone call when you are ready to schedule that appointment. And so I did just want to give a quick shout out that we are planning to have another webinar in the future. So as Crystal mentioned, this one was very community focused. We wanted to make sure community groups throughout San Antonio know that this program is going on, and we really wanted to increase awareness. But we are planning to have a second webinar that is going to be a little more individual focused. So really going through those details of enrollment and why an individual would want to join, and walking people through that process. And we would also like to give a shout out to Pyxis Partners and the Scripps Research Institute for their support in helping us put this webinar together and broadcast it. And finally, I would like to leave you today with a quote from the All of Us Research Program. And this is actually part of the All of Us Anthem. So I encourage you, if you have a few minutes, to go look up the All of Us Anthem on YouTube. It is a very powerful 1-minute video, so very short, but it says, "We're one nation, one people, but all of us are different." And it's those very differences that will lead to answers for generations to come. So the key is really in each of us. And we just ask you to be a part of this historic effort. And we thank you again for taking time to join us today. And I think that's